A very good morning to everyone. Today we have a lecture on sciatic nerve. So we have to know about the introduction of sciatic nerve, course, the branches of the sciatic nerve. Along with the branches, we have to know about applied anatomy of sciatic nerve. So sciatic nerve is known as one of the thickest nerve of the body, which is approximately 2 cm in diameter, which arise from the sacral plexus, having root value L4, L5, S1, S2, and the S3 arise from the pelvic surface. It consists of two parts, tibial part and the common peroneal part. So tibial part is formed by the ventral division of antereprimary rami having root value L4, L5, S1, S2 and S3. Same how we have the common peroneal part, which is derived from the dorsal division of antereprimary rami having root value L4, L5, S1 and S2. You can see here in the diagram the root value of sciatic nerve L4, L5, S1, S2 and S3, and it consists of two division, dorsal and the ventral division, and can you see here that it is having two part, tibial part and common peroneal part. Same how we have to know about the course of sciatic nerve, which arises from the pelvic surface through the sacral plexus. It runs downwards through the greater sciatic foramen, that is below the piriformis muscles, then runs between the greater trochanter and ischial tuberosity, then further runs that is below the long head of biceps femoris, and near the superior angle of popliteal fossa it divides into tibial nerve and the common peroneal nerve. You can see here this is piriformis muscles, and this nerve is known as sciatic nerve, which runs between ischial tuberosity and the greater trochanter. Then again it runs downwards, and near the superior angle of popliteal fossa it divides into tibial nerve and the common peroneal nerve. Now let's know about the branches of the sciatic nerve. Before dealing with the branches, you can see this is sciatic nerve, and this sciatic nerve is mostly supplying to the hamstring muscles. It means muscular branches to the biceps femoris long head, semimembranosus, semitendinosus and hamstring part of adductor magnus. It also supplies to the hip joint. You can see here in the diagram, and this is the sciatic nerve, which is having two part, tibial part and the common peroneal part. So tibial part is supplying to the semitendinosus, semimembranosus, long head of biceps femoris and adductor magnus, that is hamstring part. Now we have to know about the applied anatomy of the sciatic nerve. So whenever there is damage of the sciatic nerve, that leads to a condition known as slipping foot, sciatica, intervertebral disc prolapse leads to damage of sciatic nerve, dislocation of hip joint, piriform syndrome, intramuscular injection can damage sciatic nerve. The penetrating wounds as well as the fracture of the pelvis can also damage the sciatic nerve. And let's know all this clinical aspect in detail. We have to know about the sleeping foot. So whenever there is a sleeping foot, there is a temporary numbness of the lower limb due to compression of the sciatic nerve in the gluteal region by prolonged sitting. So if you are sitting for a prolonged time, it can compress the sciatic nerve and leads to numbness of the lower limb. Same how we have the term known as sciatica. It means there is irritation of compression of the sciatic nerve. So whenever the nerve is compressed, so nerve pains that originate from the lower back gluteal region radiates deep to the buttock along back of the thigh, travels downwards to the lateral side of the leg to the dorsum of the foot. Now can you see here in the diagram how the nerve or the pain is radiating downwards? That can be due to the intervertebral disc prolapse. Same how we have other clinical aspect. So again, if there is a damage of sciatic nerve due to penetrating wounds or dislocation of the hip joint, there can be a sensory loss on the whole leg except the foot, which is innervated by the saphenous nerve. There can be a motor loss. It means loss of the hamstring muscles, which is supplied by the sciatic nerve. Same how the loss of the foot dorsiflexor. It means the muscles of anterior compartment of leg, which is supplied by deep peroneal nerve, which is a branch of common peroneal nerve, and which is again a branch of sciatic nerve. It means there can be a loss of muscles of anterior compartment of leg. Loss of the foot plantar flexor. It means the posterior compartment muscles of the leg, which is supplied by the tibial nerve, and the tibial nerve is a branch of the sciatic nerve. It means if sciatic nerve is damaged, there can be damage of posterior compartment muscles. Loss of evators of the foot. It means the peroneus longus and brevis supplied by superficial peroneal nerve, and there is a loss of the all movements below the knee joint, and this all the conditions leads to a term known as foot drop, mostly the muscles of anterior compartment of the leg. There can be a piriform syndrome. It means if there is a swelling or the spasm of the piriformis muscles which can compress the sciatic nerve, and whenever there is a compression of the sciatic nerve, what happens here? There can be a pain or the numbness and the tingling sensation along the back of the leg and into the foot. So that's all about sciatic nerve. Thank you.